Now there are subtle differences with respect to what is the exact site. We know the routes of administration, but the exact site when they are given. Okay, so BCG vaccine that is given in the that is given through intradermal route, that is given on the left upper arm. Okay, left upper arm. What was one more vaccine that is given through intradermal route? That is FIPV, right? So the fractional IPV or the FIPV was one more vaccine that was given through the intradermal route. So it is this one. So this has to be given on the right upper arm. Okay, so one of the intradermal is given on the right, one of the intradermal is given on the left. BCG have already given on left upper arm, intradermal. So you will give the fractional IPV, which is also needs to be given intradermally. You will give it on the right side, right? Now then you have the OPV, which is given oral. No such site is there. Remember one thing, that whatever vaccines are given intramuscularly up till this age, that is 2 years of age, they are given in the anterolateral thigh, right? So whatever intramuscular vaccines that are given up to this age, that is here, the cutoff is here, are given to anterolateral thigh. The reason is the muscle mass in the anterolateral thigh region is more as compared to that in the upper arm or the gluteal region. That is why in the anterolateral thigh region, intramuscular injection is given, right? So that means your pentavalent or your hepatitis or even your PCV, the what else? Yeah, PCV, then your DPT booster. So DPT booster, remember DPT booster 1, only DPT booster 1 is given at the anterolateral thigh, whereas after 2 years of age, that is around 5 to 6 years, the muscle mass in the upper arm is adequate. So your DPT booster 2 is going to be given in the upper arm region. So that is an exception that you have to remember. And even your TDs, they are also going to be given in the upper arm region. They are also intramuscular, right? So that thing you have to remember, right? Next, coming on to the subcutaneous ones. So which are the subcutaneous ones? MR and JE, right? So given at 9 to 12 months and 18 to 24 months. Remember that. So your friend of BCG is your JE. JE is the friend of your BCG. Whereas FIP, who is the friend of FIPV? Who remains? It is MR. So MR is the friend of FIPV, right? So remember that. Why so? Why MR is given on the right side? Why J is given on left? Because you see, both are given through subcutaneous route, right? So and they are given during the same timeline. So 9 to 12 months, 18 to 24 months. So during the same immunization session, you are going to give the two vaccines, both the vaccines. So you do not want to give it on same side. So just for that sake, you will give it on one side and the other on other side, right? So that is the logic behind the exact site where it is going to be given. Here you can see again, this image emphasizes that very thing. So if you can see here, so BCG is given on the left upper arm and FIPV is given on the right upper arm. Who's friend of BCG? J is friend of BCG, MR is friend of FIPV. Okay, one more thing that I did not mention was the pentavalent and the PCV, right? So PCV is given at 6, 14, pentavalent is given at 6, 10 and 14. So what are the other vaccines that are given at 6, 10 and 14? You have the OPVs, OPV 1, 2, 3 that is given. Then you have the rotavirus 1, 2, 3 that are given, right? So but they are given through oral route. So there is no problem with that. Even FIPV that's given at 6 and 14 week, that is given intradermally, in this region it is given. So again there is no problem. But PCV and pentavalent, they are given intramuscularly, right? Intramuscular. So they have to be given to anterolateral thigh. But you can't give it on the same side. So you will give it on one on either side. So by convention, pentavalent is given on the left and pneumococcal is given on the right. Okay. So remember, so this is the exact site where these vaccines are given. Now finally, it is the dose of these vaccines that you have to remember. Again, that is easy with some amount of practice. So BCG, you are going to give 0.1 ml. Intradermal, remember they are given any intradermal vaccine or intradermal preparation for that matter, even in the tuberculous skin test, you are going to give 0.1 ml, right, of the tuberculin antigen or the tuberculin protein there. So intradermal it is 0.1 ml, but you need to understand with the BCG it is slightly tricky. There is also 0.05 ml, that is actually the standard dose. So we'll try to not try to fall into that though. For now let us know that it is 0.1 ml, but generally it is 0.01 ml. That is when it is given at birth, it is this dose that is to be given, remember, but for the simplification sake it is 0.1 ml, right. Next, which is the vaccine that is there. So let's go by this diagram only. So you have the MR and the JE. So MR is given that is the logic here, remember. So all your subcutaneous and all your intramuscular vaccines are 0.5 ml. So MR will be 0.5 ml, your JE is 0.5 ml, PCV is 0.5 ml, pentavalent is also 0.5 ml. All your subcutaneous and intramuscular vaccines are 0.5 ml ones that are given. Okay, then coming on to so you are done with your subcutaneous, intramuscular, intradermal, all the ones that are given through the skin but at different angulations, right. You have known the doses also, 0.1 ml, 0.5 ml, 0.5 ml, right. So intradermal, subcutaneous, intramuscular. Now coming on to the oral ones. So oral ones, you have the OPV, rotavirus, and vitamin A. For now we have not discussed about vitamin A. So what we have discussed is OPV and the rotavirus. So this is going to be given through oral route. What are the dosages? It is 2 drops of OPV, 5 drops of rotavirus. Okay. So 2 booнд Raksha ki, that has been said, that is for the protection. So 2 drops, that was the campaign. So 2 drops OPV, right. Then rotavirus, it is 5 drops. And for now we have not discussed the schedule of the vitamin A, but let us discuss here. So that is also quite simple. So it is given at 9 to 12 months, the first dose, and then the second dose is given 15 to 18 months, or you can write it as 18 to 24 months, that is the 2 year. So this is 1 year and this is the 2 year, right. First dose will be given 9 to 12 months and the second dose during 18 to 24 months. So first time koduvaga it has to be less, the dose is to be less, that is 1 ml you are going to give, whereas second time you will give 2 ml. So how do you give it? It is given in a spoon which has the measuring there, a marking within which if you fill the vitamin A, that will be 1 ml. Beyond this marking, whole of the spoon is filled, then that is 2 ml. So it is given in the form through spoon. Whereas your OPV and rota vaccines, they are given through dropper. So to the vaccine vial, a dropper will be attached. Okay. So that is a differentiating factor between OPV and rotavirus. In OPV vaccine, it is a white dropper that is attached, whereas in rotavirus it is a pink dropper that is attached. Okay, and both in OPV as well as rotavirus, the vaccine color is going to be pinkish only, but the dropper color is what differs, the white and pink color. Okay, so this was all about the vaccines under National Immunization Schedule and their schedule. So 4 objectives that we have studied. So what is the vaccine, when it is given, how is it given, and how much is given. Right. Thank you.